Did you know that over 65% of people above 60 are unknowingly taking at least one medication that research shows can literally erase their memories? What's even more shocking is that one of these medications is sitting in 80% of family medicine cabinets right now, and you probably have it in yours. I'm Dr. Elena Carter, a physician with over 10 years of experience specializing in health and quality of life for people over 50. Today, I'm going to reveal the 4 specific medications that worry geriatricians worldwide the most, including common sleep aids like diphenhydramine, anxiety medications like Ativan, a pain medication that's increased 3,000% in prescriptions over the last decade, and even that innocent heartburn pill you take daily. Throughout this video, you'll discover exactly how to identify these medications in your medicine cabinet, what warning signs to watch for, and most importantly, what safe and effective alternatives exist. Let me start with a question that might hit close to home. Have you noticed yourself forgetting keys or names more often since turning 60? Maybe you've misplaced your phone more frequently lately? You might think this is just normal aging, and perhaps your doctor even told you it's part of the process. But what if I told you that what you're experiencing might not be aging at all, but rather the hidden effects of medications you trust? 3 months ago, Margaret, a 67-year-old retired teacher, came to my office in desperation. She told me, "Doctor, I feel like I'm losing my mind. I can't remember yesterday's conversations. I'm missing important appointments, and my family is worried sick." Do you know what we discovered? It wasn't Alzheimer's, it wasn't dementia. It was something much simpler and, fortunately, completely reversible. Margaret was taking 4 seemingly harmless medications that were working silently behind the scenes, literally robbing her of her memory. Here's what's truly alarming. According to recent research from Harvard University, more than 65% of people over 60 are taking at least one of these memory-stealing medications that I'm about to reveal today. And one of these drugs is found in 80% of family medicine cabinets. You probably have it in yours right now. Over the next several minutes, I'm going to show you exactly which 4 medications cause the greatest concern among geriatricians worldwide. I'll teach you how to identify them in your medicine cabinet, what warning signs you should look for to know if they're affecting you, and most importantly, what safe and effective alternatives are available. Look, I've been working with older adults for many years, and I've witnessed how small changes in medication can completely transform a person's life. Margaret's story didn't end with that desperate consultation. 3 months later, after making the adjustments I'm going to share with you today, Margaret returned to my office. Her exact words were, "Doctor, I feel like I got my mind back." That's exactly what we're going to achieve today. By the end of this video, you'll have a practical tool, a checklist that you can use immediately to evaluate your current medications. Who knows, you might discover that the solution to those memory lapses is closer than you imagine. But before we begin, let me be crystal clear. I'm not going to ask you to stop anything on your own. What we're going to do is educate you so you can have informed conversations with your doctor, because knowledge is power, and your mental health is too valuable to leave to chance. Let's start with the first medication. The first group of medications I want to show you are anticholinergics. I know this name sounds complicated, but stay with me because this is simpler than it appears. Anticholinergics are found in medications you probably recognize: Benadryl for allergies, Dramamine for motion sickness, over-the-counter sleep medications like Zizquil, even some antidepressants, and medications for urinary incontinence. In fact, that sleep medication you use to sleep better could literally be shutting down important connections in your brain. Let me explain why. Your brain functions like an incredibly sophisticated electrical network. For you to form memories, concentrate, and think clearly, neurons need to communicate with each other using chemicals called neurotransmitters. One of the most important for memory is called acetylcholine. Imagine acetylcholine is like your brain's Wi-Fi. Anticholinergics are like someone who comes in and unplugs the router cables. The more potent the medication, the more cables get disconnected. A fascinating study from the University of Washington followed more than 3,000 people over 65 for 7 years. What did they find? People who took anticholinergics regularly had a 54% higher risk of developing dementia. 54% is a figure we cannot ignore. Now, before you panic, let me tell you about Robert. This 72-year-old patient had been taking Benadryl every night for 2 years to sleep. His children noticed he was becoming more forgetful, confused, and even somewhat aggressive. When we evaluated his medications and gradually replaced the Benadryl with safer alternatives, within 6 weeks, he was like a completely different person. His wife told me, "I got my husband back." How do you know if anticholinergics are affecting you? Pay attention to these symptoms. First, more frequent forgetfulness than normal. I'm not talking about occasionally forgetting where you put your keys, but consistent patterns of memory loss. Second, difficulty concentrating. If you used to be able to read a book or follow a movie without problems and now you struggle, it could be a sign. Third, confusion, especially at night. Many patients tell me they feel cloudy or like they're in a fog. Fourth, and this is important, persistent dry mouth, constipation, and difficulty urinating. These are typical effects of anticholinergics. Here's something very practical. There's a simple way to know if your medication is anticholinergic, and I'm going to teach it to you right now. First, look for medications ending in amine, like diphenhydramine, Benadryl, or dimenhydrinate, Dramamine. Second, check over-the-counter sleep medications. Most contain diphenhydramine or doxylamine, both potent anticholinergics. Third, first-generation allergy medications. If they make you very sleepy, they're probably anticholinergic. Fourth, some tricyclic antidepressants like amitriptyline and bladder control medications like oxybutynin. What can you do if you identify that you're taking any of these? First, don't stop them abruptly. Some can cause dangerous rebound effects. Second, talk to your doctor about alternatives. For allergies, second-generation antihistamines like loratadine, Claritin are much safer for the brain. For sleep, low-dose melatonin, sleep hygiene techniques, or even cognitive behavioral therapy for insomnia are excellent options. But anticholinergics are just the first group. The second group of medications I want to show you is even more concerning because many people don't realize how addictive they can be. If you've heard of Ativan, Xanax, Valium, Klonopin, or Restoril, we're talking about benzodiazepines. And let me be very direct with you. These medications are especially problematic after age 60. According to the American Geriatric Society, approximately 1 in 4 older adults takes benzodiazepines. But here's the problem. After 60, your body processes these medications completely differently. When you're young, your liver and kidneys work like perfect machines, processing and eliminating drugs efficiently. But with age, this process becomes slower, much slower. It's like you used to have an 8-lane highway to eliminate the medication, and now you only have 2 lanes with heavy traffic. The result is that the medication accumulates in your system, stays longer in your brain, and side effects intensify. And here's something doctors don't always tell you clearly. Benzodiazepines can cause permanent cognitive deterioration, even after stopping them. Let me tell you about Elena, a 68-year-old retired professor. She had been taking Ativan for 3 years for anxiety after her husband's death. When she came to see me, she said something I'll never forget. "Doctor, I feel like I lost my intelligence. Before, I could solve difficult crossword puzzles, read complex books, handle my finances. Now I struggle to remember what I ate for breakfast." The process of helping Elena gradually reduce the benzodiazepines took 6 months, 6 long and difficult months. But in the end, she recovered much of her mental clarity. Although, and this is important, some effects took more than a year to completely reverse. Why do benzodiazepines affect memory so much? They work by enhancing a neurotransmitter called GABA, which is basically your brain's brake. It calms you, reduces anxiety, helps you sleep. But imagine someone pressing your car's brake pedal. Yes, it reduces anxiety, but it also slows essential processes like forming new memories and memory consolidation. A study in the British Medical Journal followed more than 27,000 people for 15 years. The results were alarming. Benzodiazepine use for more than 3 months was associated with a 51% increase in dementia risk. How do you know if benzodiazepines are affecting you cognitively? First, memory difficulties that go beyond normal forgetfulness, problems forming new memories or remembering recent events. Second, changes in your ability to concentrate. If activities you once enjoyed now seem mentally exhausting. Third, what we call anterograde amnesia, not remembering things that happened while under the medication's effect. Fourth, and this is subtle but important, changes in your personality. Some patients become more apathetic, less interested in activities that once excited them. Here comes the main conflict. "Doctor, my physician prescribed it for anxiety. I need it to function." Now, what do? I completely understand this dilemma. Anxiety is real, debilitating, and deserves treatment. But it's also true that safer alternatives exist, especially for long-term use. For anxiety, cognitive behavioral therapy has proven to be as effective as benzodiazepines, but without cognitive risks. Antidepressants like SSRIs can also manage chronic anxiety more safely. For insomnia, low-dose trazodone, melatonin, or sleep hygiene techniques are much better long-term options. If you're taking benzodiazepines, never stop them abruptly. It can be dangerous and even cause seizures. The process must be gradual, medically supervised, and can take weeks or months. But I want you to know it's possible. I've helped hundreds of patients make this transition successfully. Yes, it requires patience and adequate medical support, but your mental clarity is worth the effort. Now, the third medication we're going to discuss is one many doctors consider safe and prescribe for practically everything, but the reality is very different. Gabapentin, also known as Neurontin. If you haven't heard of it, get ready, because it's very likely your doctor will mention it at some point. This medication is prescribed for everything: nerve pain, seizures, anxiety, insomnia, menopause, hot flashes, restless leg syndrome. It's like the miracle drug of recent years, but no one talks about its hidden cognitive risks. Do you know how much gabapentin prescriptions have increased in the last 10 years? 3,000%. It's one of the fastest growing medications in prescriptions, especially in older adults. Why do doctors prescribe it so much? Because officially, it's not addictive like opioids, doesn't have the regulatory restrictions of benzodiazepines, and seems relatively safe in terms of serious side effects. But here's the problem. Studies on gabapentin and cognitive function in older adults are limited. Most research was done on young people and for short periods. How does gabapentin affect cognitive function? Although the exact mechanism isn't completely clear, we know it affects calcium channels in the brain, altering communication between neurons. It's like turning down the volume on all conversations in your brain. Yes, it reduces the noise of pain or anxiety, but it can also reduce important conversations for memory and thinking. A 2022 study published in the Journal of the American Geriatric Society found that older adults taking gabapentin had significantly lower scores on cognitive function tests compared to those not taking it. Who is at higher risk for cognitive effects with gabapentin? First, adults over 65, especially those with reduced kidney function, because gabapentin is primarily eliminated by the kidneys. Second, people taking high doses. The higher the dose, the greater the risk of cognitive effects. Third, those combining it with other medications affecting the central nervous system. Here's something very practical. There's a simple test you can do at home to assess if gabapentin is affecting your cognitive function. It's what we call the verbal fluency test. Take a stopwatch and give yourself 1 minute to name all the animals you can. A cognitively normal person can name between 18 to 22 animals in a minute. If you consistently have trouble reaching 15 animals, especially if you could do better before, it could be a sign that some medication is affecting your cognitive function. Now, this isn't a definitive diagnosis, but it's a useful tool for monitoring changes in your cognitive function. Does this mean you should never take gabapentin? Not necessarily. For some conditions like severe nerve pain or certain forms of epilepsy, the benefits may outweigh the risks, but it does mean you should be more conscious. First, use it at the minimum effective dose and for the shortest possible time. Second, monitor your cognitive function regularly. The test I taught you is a useful tool. Third, explore alternatives for conditions like anxiety or insomnia, where safer options exist. For nerve pain, options like duloxetine or certain newer anticonvulsants may be equally effective with fewer cognitive effects. For anxiety or insomnia, as we've discussed, many safer alternatives exist. But wait, because the fourth medication we're going to discuss is one you probably never suspected could affect your memory. It's so common, so innocent, that millions of people take it daily without thinking about the consequences. Proton pump inhibitors, omeprazole, pantoprazole, esomeprazole, lansoprazole. If any of these names sound familiar, we're talking about proton pump inhibitors, or PPIs, the heartburn medications that millions of people take every day. And yes, that innocent heartburn medication you probably have in your medicine cabinet right now could be silently affecting your cognitive function. Did you know that PPIs are among the most prescribed medications in the world? In the United States, more than 15 million people take them regularly. And here's the problem. Most use them for much longer than recommended. Let me ask you something. How long have you been taking heartburn medications? If your answer is more than 8 weeks, you need to pay close attention to what's coming. PPIs create what we call acid rebound. When you try to stop them, your stomach produces even more acid than it originally produced. This makes you feel like you need them, creating a cycle that can last years. Frank, a 69-year-old retired accountant, had been taking omeprazole for 5 years. He started with 20 milligrams daily for occasional heartburn after large meals. When he came to see me, he was taking 40 milligrams twice daily and still had symptoms. But Frank didn't come for stomach problems. He came because his wife noticed he had become more forgetful and confused. "Doctor," he told me, "I feel like my mind has become slower. Before, I could handle complex numbers without problems. Now I need a calculator for everything." What does heartburn have to do with memory? More than you imagine. PPIs don't just reduce stomach acid, they also affect the absorption of nutrients crucial for brain function: vitamin B12, magnesium, iron, and vitamin D. Think of your brain as a high-performance car. It needs premium fuel to function optimally. PPIs are like putting low-quality gasoline in it for years. The car will keep running, but not at optimal level. Vitamin B12 deficiency is especially problematic. This vitamin is essential for myelin formation, the insulation of nerves. Without enough B12, nerve impulses become slower, affecting memory, concentration, and mental processing speed. A 2016 study in the journal JAMA Neurology followed more than 73,000 people over 75. They found that those who used PPIs regularly had a 44% higher risk of dementia compared to those who didn't use them. But nutritional deficiency isn't the only problem. PPIs can also alter the intestinal microbiome, and we know there's a direct connection between gut health and brain function, what we call the gut-brain axis. How do you know if PPIs are affecting your cognitive function? First, persistent mental fatigue, especially if you previously had more mental energy. Second, difficulty concentrating on tasks that were previously easy. Third, memory problems that go beyond occasional forgetfulness. Fourth, mood changes, especially mild depression or anxiety you didn't have before. Here comes the big dilemma. "Doctor, but I need these medications for my stomach. Without them, heartburn makes my life impossible. What do I do?" I completely understand this conflict. Peptic ulcers and severe reflux are real conditions that need treatment. But it's also true that many people use PPIs for problems that could be managed other ways. If you've been taking PPIs for more than 8 weeks, consider this gradual approach. First, reduce the dose slowly. If you take 40 milligrams daily, go down to 20 milligrams for 2 weeks, then every other day. Second, implement lifestyle changes. Smaller, more frequent meals. Avoid eating 3 hours before bedtime. Elevate the head of the bed. Third, consider alternatives like short-acting antacids for occasional symptoms. Some patients have had success with specific probiotics, digestive enzymes, or even dietary changes like reducing processed foods and increasing vegetables. If you decide to continue PPIs for valid medical reasons, consider supplementing with vitamin B12, magnesium, and vitamin D under medical supervision. And very important, have your B12, magnesium, and vitamin D levels checked annually if you take PPIs long-term. Now that we've seen these 4 medication groups individually, it's time to reveal something that could change everything. Something most doctors don't tell you about how these medications work together. Imagine each medication is like turning down your mental radio volume a little. 1 alone and you barely notice. 2, and you start having trouble hearing clearly. 3 or 4, and suddenly you find yourself living in cognitive silence. A University of Michigan study found that older people taking 3 or more of these types of medications have a 67% higher risk of significant cognitive impairment. Why don't doctors detect this more frequently? Because the healthcare system is fragmented. The cardiologist prescribes one thing, the gastroenterologist another, the neurologist yet another. Rarely is there someone seeing the complete picture. We've reached the end of this journey, but in reality, this is the beginning of your new relationship with your cognitive health. The stories I've shared with you today aren't isolated cases. Every week, I see patients who have recovered their mental clarity simply by making intelligent adjustments to their medications under proper medical supervision. Remember, the goal isn't to live without medications when you need them. The goal is to be an informed patient who can work with their doctor to find the safest and most effective options for their unique situation. Your mind is your most valuable asset. It deserves the same care and attention you give to any other important aspect of your health. If this video helped you, there's something very important you can do. Share it with someone who needs it, that family member, that friend, that person in your life who might be going through the same thing Margaret went through. Because information saves lives, and mental clarity is too valuable to leave to chance. I want to hear from you in the comments. Have you noticed memory changes since starting any medications? What questions do you have about the medications you're currently taking? Your experience could help someone else watching this video. Don't forget to subscribe to this channel if you want to stay updated on the latest information about health and quality of life after 50. Hit the like button if this content was useful to you, and ring the notification bell so you don't miss our upcoming videos where we'll continue building your best version. Until next time, take care of your mind, because it's the foundation of everything else in your life.